look that up, but I know on some television show somewhere I've seen some strange fish poisonings. But one would wonder, like the house or something.
On TV
Yeah. But so I would like to go back and look that up because I think they're rare fish that really have these toxins, rare raw fish. But otherwise, did she just get some run-of-the-mill parasite?
Right.
I don't know.
And it seemed 29 years ago, so that's why I wasn't thinking.
You think it has bearing on
Well,
the
I'm just kind of wondering, sometimes when I got a little sidetracked on that, I have to admit. This was a patient in my practice, and my thought process was a little bit along the lines of if she encountered some toxin and she had some severe digestive disruption that never really got treated, could that manifest and not self-correct over maybe even decades and contribute to, because remember she has eczema, she's got some other kind of autoimmune type or inflammatory type conditions.
And
that's way too naturopathic for me.
Oh, okay.
Not for me.
Help me out.
Well, we know that the microbiota is extremely important. We know that what separates our gut from our blood is one cell. The epithelial lining is crucial, and there's neuroendocrine connections there is immunological connections there, there's absorptive connections there's all sorts of different connections there. And we know now with the studies that have recently come out that there's a connection between autoimmune disease and increased gut permeability. So is there a connection here? Well, you see a very stressed individual, when their stress comes out, what happens when you have stress? You have a sympathetic response, which shunts blood away from the gastrointestinal tract, which does increase gut permeability. We've seen that. And that exacerbates her eczema. She also has a history of asthma. There's a lot of autoimmune stuff going on here. Could that have been the initial stages of all this? I mean, is that a contributing factor? Every patient that comes in my clinic, I look at that. I've always looked at the gastrointestinal tract because it's such a critical element in systemic health.
I want to piggyback on that and go back to the fish, though, because and how my mind starts to think about it is sometimes when somebody has an allergic reaction, or most of the time, instead of pointing the finger at the antigen, I want to point the fingers back to, okay, why did the body have such a severe reaction? Knowing her history of sinusitis, knowing how it was treated with an antibiotic each and every time, so that history of antibiotic use, proposed probably disruption of microflora, where is most of our immune system? Right there hanging out in the gut. Has that been severely disrupted to the point where she really didn't have the resilience, and she had such a strong inflammatory infectious reaction to this fish? And so this might have been a gut issue way back when that, as you said, probably was never, we never probably re-inoculated with good bacteria and restored that to any significance.
But the sinus infections came later, I believe.
They did come later, yes.
Not first.
Yes.
I thought that there was a history of sinusitis that she
did have a history of bronchitis as well, which I didn't mention just now.
And I would think that even if she offered it or not, that was her course of treatment before.
Right. She has a lifelong history of seasonal allergies, among other things.
There could be some relationship to the mold as well.